Hello students, welcome to EPG Pathshala. I am Dr. Radha, Assistant Professor from Department of Food Service Management and Dietetics, Avinashlingam Institute for Home Science and Higher Education for Women. In today's session, let us learn about gout. Hope you all know what is gout. Gout is a disease related to abnormal metabolism of uric acid, resulting in an excess of uric acid in the tissues and blood. People with gout either produce too much of uric acid or more commonly their kidneys are inadequate in removing it. There are a number of possible consequences this buildup of uric acid in the body, including acute and chronic gouty arthritis, kidney stones and local deposits of uric acid in the skin and other tissues. Hope you know there are two types of gout. The primary gout arises due to hereditary conditions, whereas the secondary gout is an acquired disease. Let us see what is primary gout. Primary gout is the result of metabolism problem associated with insufficient removal of waste by the kidneys. In the case of secondary form, the gout is caused by the illness such as tumors, anemia and diabetes mellitus with kidney function problems. Nutrition related causes include total fasting and the increased consumption of non-vegetarian foods and even consumption of alcohol also. The prevalence of gout appears to be increasing nowadays. After going through this module, you will be able to explain what is gout, causes and symptoms of gout, and also you will be learning the diagnostic methods, home remedies and dietary management of gout. Now, let us learn what is gouty arthritis. It is a sudden onset of painful, red, swollen joints, particularly in the foot at the big toe. Gouty arthritis is reportedly the most common cause of inflammatory arthritis in men over the age of 40. Gouty arthritis is diagnosed by detecting uric acid, that is monosodium urate crystals, in an aspirated sample obtained from the fluid collected at the joints. These uric acid crystals can accumulate in the joint and tissue around the joints over a period. This buildup of crystals trigger intermittent bouts of acute inflammation. In the long run, this buildup can cause gouty arthritis, or it is also called as flares. This can damage the joints and lead to chronic arthritis. Though gout is a progressive disease, there are effective medications available to treat gout. Let us learn the causes of gout. Uric acid is generated as we metabolize the food we eat and as the body's tissues are broken down during the normal cell turnover. Some people with gout generate too much of uric acid, that is 10% of those affected are medically referred to as overproducers, and other people with gout, they do not effectively eliminate the uric acid into the urine, that is 90% of them are falling into this category and they are medically referred to as underexcretors. Now let us see what causes excessive uric acid in the blood. Organic compounds like purines are changed into uric acid by the metabolic activity of the body. Uric acid is then eliminated from the body through the kidneys. If this function is disturbed, as in the case of primary gout, the uric acid will remain in the body, and this means that uric acid level in the blood will increase. We also absorb uric acid from our food, particularly from non-vegetarian, that is animal products. Let us see how does uric acid cause gout. Increased uric acid levels usually remain unnoticed for many years due to the lack of symptoms. Ultimately, however, permanently increased uric acid levels will result in gout. These increased levels cause the formation of uric acid crystals. These crystals tend to gather in the large toe, in the tendon, sheaths and ear cartilage, or in the kidneys as stones. Gout attacks typically occur by the way of severe pain accompanied by extreme redness and swelling in these areas. Gout can be managed through timely diagnosis, proper and regular medications at the right time, and following a nutritious and also a balanced diet and leading a healthy lifestyle. Now, let us learn the risk factors of gout. The genes that we inherit, the male gender, kidney functions and nutrition, that is whether the person is alcoholic or obese, also matters. They play a key role in the development of gout. Gout is not contagious, one has to remember this. But if your parents have gout, then you have 20% chances of developing it. British people are 5 times more likely to develop gout than others. American blacks, but not African blacks, are more likely to have gout than other populations. Post-pubertal males are at high risk for gout compared to women. People with insufficient kidney function are also at increased risk for gout. Intake of alcoholic beverages, especially beer, increases the risk of gout. Diet rich in red meats, internal organ meats, yeast, shellfish and oily fish increases the risk for gout. Uric acid levels increase at puberty in men and at menopause in women. So, men first develop gout at an earlier stage, that is after puberty, than do women, that is they have more chances after menopause only. Gout in premenopausal women is distinctly unusual. Attacks of gouty arthritis can be precipitated when there is a sudden change in uric acid levels, which may be caused by overindulgence in alcohol and red meats, trauma, starvation and dehydration, chemotherapy, medications, diuretics and some other antihypertensive medications, aspirin, nicotinic acid, cyclosporin, allopurinol and probenecid. Let us see what are the factors that are responsible for gout attack. Overweight, that is many patients who suffer from gout are overweight or obese nowadays. Alcohol, acute attacks of gout are often precipitated by overindulgence in alcohol. Dietary purines, eating foods rich in purines, that is consumption of meat, fish and fish roes, can also cause an attack. Starvation or very low energy diets, that is low calorie foods. Blood urate level rise dramatically when body proteins are broken down due to starvation or when an individual consumes low calorie foods. Kidney diseases. Any disease such as chronic renal failure, which prevents the kidney from functioning properly and excreting sufficient urate, can cause gout. and other diseases such as leukemia, a type of cancer, or psoriasis, a type of skin problem, can also cause increase in urate production. And regarding drugs, chemical compounds which decrease the excretion of urates, such as so-called thiazide diuretics used to treat hypertension and edema, can also cause a gout attack. Many of you may be knowing the signs and symptoms of gout. Now let us discuss about this. The first symptom of gouty arthritis is typically the sudden onset of hot, red, swollen, stiff and painful joints. The most common joint involved in the foot at the base of the big toe, where swelling can associated with severe tenderness, but almost any joint can be involved. For example, knee joints, ankle and small joints of the hands. In some people, the acute pain is so intense that even a bed sheet on the toe can cause a severe pain to them. Acute gouty arthritis at the base of a big toe is referred to as podagra. Even without treatment, the first attack stops spontaneously, typically within 1 or 2 weeks. While the pain and swelling completely go away, gouty arthritis commonly returns in the same joint or in another joint of the body part. With time, attacks of gouty arthritis can occur more frequently and may last for longer. While the first attacks usually involve only 1 or 2 joints, multiple joints can be involved simultaneously over time. It is important to note that unrecognizable, that is subclinical, potentially damaging inflammation in the joints can occur between attacks of obvious flares of gouty arthritis. Kidney stones are more frequent in people with gout. Uric acid crystals can form outside joints. That is, collection of these crystals, complications known as topi, can occur in the earlobe, elbow and in the tendon, that is back of the ankle, or in other tissues. Typically, these topi are not painful. However, they can be a valuable clue for the diagnosis, as the crystals that form them can be removed with a small needle for diagnosis by microscopic examination. Microscopic evaluation of topus reveals uric acid crystals. So one has to seek medical care for the gout. Let us learn about this now. Anyhow, who has a sudden onset of hot, red, swollen joints should seek medical care either with a primary care physician at an emergency department or with a rheumatologist, that is arthritis and gout specialist. These symptoms can also be due to infection, loss of cartilage in the joint, or because of some other reasons also. It is important to make an accurate diagnosis of gouty arthritis for optimal treatment. If one has been diagnosed with gout and has had more than one attack of arthritis, take the medication prescribed by a physician for these attacks. Then the individual should be seen by a physician in the emergency department or urgent care center if the attack does not respond to this kind of treatment. The individual may need regular medications to prevent further arthritis flares. Attacks of abdominal pain due to kidney stones may be related to uric acid and kidney stones from gout. There are few diagnostic tests that are available Gout is treated by primary care doctors, including generalists, internists, and family medicine physicians. Rheumatologists have a special interest in diagnosing and managing gout. Joint aspiration. This is the most important diagnostic test. It is the ultimate method of being certain of a diagnosis of gouty arthritis as opposed to other causes such as an infection in the joint. A needle is inserted into the joint to withdraw a sample of fluid for testing. The fluid is examined under the microscope to see if there are gout crystals or excess of uric acid or the signs of bacterial infection present. Sometimes other crystals can be found in the joint fluid, such as calcium pyrophosphate, which is caused by an entirely different condition called pseudo-gout. It is also like gout only. Gouty arthritis is sometimes diagnosed based on the typical clinical presentation without a joint aspiration. Blood tests. A doctor may obtain a blood sample to look at cell counts, uric acid levels, and also to check the kidney function. Unfortunately, the level of uric acid in the blood cannot be reliably used to make a diagnosis of gout. It is normal in approximately 10% of people during an attack of gouty arthritis. Moreover, uric acid levels are elevated in 5% to 8% of the general population. So, the presence of an elevated level does not necessarily mean that gout is cause of an inflamed joint. Interestingly, the uric acid is typically lowered during a flare of inflammatory gouty arthritis. Therefore, the optimal time to measure the uric acid is after a flare has resolved, when acute inflammation is not present. Uric acid, actually the normal level of uric acid in blood for men should be 3.5 to 7 milligram per deciliter, and the same for women it is 2.5 to 5.7 milligram per deciliter. Each one should remember this normal and reference values. Radiographs are also useful in the diagnosis of gout. X-rays are primarily used to assess the underlying joint damage, especially in those who have had multiple episodes of gouty arthritis. Now, let us see some home remedies for gout. This will be useful for all of us. Take medications as prescribed. While a joint is hot and swollen, one may want to use a cane or simple support to keep weight off their joint. It may be helpful to keep the swollen joint elevated above the chest as much as possible. Ice packs can be helpful in relieving pain and reducing inflammation. Maintaining adequate hydration is key for minimizing the frequency and intensity of gouty attacks. Drinking cherry juice may decrease the intensity and severity of the attack. Not only cherry juice, any fruit juice can also be consumed. Avoiding eating red meats, internal organs, that is organ meats, yeast, shellfish and oily fish, because these increases the risk for gout. Gout surgery, it is not so common, but one has to know about this also. Surgery is rarely needed for gout unless significant joint damage has occurred from lack of effective treatment. Surgery can be used to remove the topi, it is critically important to follow up with the doctor. Gouty arthritis is treated in 2 stages. The first stage is to treat the acute arthritis. The second stage is to prevent the gouty arthritis attacks from happening again. Low doses of anti-inflammatory mechanisms and also the anti-inflammatory medications may be used for an acute attack. One will need to follow up with the doctor after the acute attack has resolved to determine if it is necessary to start the medications to lower the blood uric acid level. If you are at risk for gout, you should do the following. That is, you have to follow the dietary changes to prevent gout. Eat a low cholesterol, low fat diet. Actually, people with gout have a higher risk for heart disease. This diet would not only lower the risk of gout, but also your risk for other type of heart disease. So control the cholesterol. Fat-free diet is useful in this case. Use a low purine diet and avoid foods that are high in purines. The biochemical in food that is metabolized into uric acid is the problem, including shellfish and red meat should be avoided. Slowly lose weight. This can lower your uric acid levels. Losing weight too rapidly can occasionally precipitate gout attacks also. So one should be very careful in this. Restrict your intake of alcohol, especially beer. Stay hydrated, drink lot of fluids. Increase your intake of dairy products such as non-fat milk and yogurt because they can lower the frequency of gouty attacks. Avoid fructose such as a corn syrup. Talk to your own doctor if you are taking diuretics, aspirin or nicotinic acid. Following are the foods that have to be limited. Organ meats such as liver, kidney, brains, meat including beef, pork and lamb, caffeine and other carbonated beverages and beer are the foods that has to be consumed occasionally. Fish and seafoods, that is other than pureed seafood, oatmeal, wheat bran and wheat germ. Even other brands from minor millets also has to be taken care. Foods those are safe to eat are green leafy vegetables and tomatoes, root vegetables, any type of fruit, breads and cereals that are whole grain, butter, buttermilk, cheese and eggs, chocolates and cocoa products, peanut butter and nuts. Some of the dairy products that may lower the risk of gout are low fat or non-fat milk and low fat yogurt. A typical diet, that is a model menu for the management of gout, is shown here. This can be followed by anyone. Early morning, they can have strained apple juice. For mid-morning, that is they can have 120 ml of strained apple juice, and for mid-morning they can have for breakfast they can have cornflakes, low fat milk. Cornflakes may be maximum of 150 grams and low fat milk of 100 or maximum 150 ml. And for mid-morning they can have 120 gram of any type of cut fruits. For lunch, 120 ml of carrot rice. A simple carrot can be cooked and mixed with rice, and eggplant fry, that is brinjal fry, it is of 80 grams and maximum 100 grams of raita. For evening they can have 120 ml of boiled sweet potato. For dinner, 2 number of appam can be consumed with 100 ml of potato stew. This is the model menu and it is flexible. Anybody can change this menu according to the foods to be included and excluded. Hope all of you have learnt what is gout, what are their signs and symptoms, and what are the possible causes, also the risk factors. So this will be helpful to you for the management of gout. And also you have learned the types of gout and how it can be managed by means of diet. And this kind of model menu will be useful to you. And one has to know, like, gout can be managed through timely diagnosis, proper and regular medications at the right time, and following a nutritious and well balanced diet and leading a healthy life.